Hi, Cynthia.
Good morning, Cynthia.
Good morning, Doctor. Good morning, Karen. How are you today?
Doing well. How are you?
Great.
Great. Thank you for your time. Michigan Mom Living appreciates it this morning. We're talking about Breast Cancer Awareness Month and I guess breast reconstruction. So I guess I'll start with Karen.
Great.
You're someone who's undergone breast reconstruction. Tell us about your personal journey, the diagnosis, reconstruction, and what you have to share with everyone.
Sure. Thanks, Cynthia. In 2009, I was diagnosed with the BRCA1 gene, or BRCA gene, and I was given some statistics about my likelihood of developing breast cancer that were very serious. And I worked with a team of doctors. And then 2 years later, I did decide to undergo bilateral mastectomy and reconstruction when I began developing signs of breast cancer. And I worked with a board-certified plastic surgeon who is a member of the American Society of Plastic Surgeons. And that doctor, along with my breast doctor and a large team of medical professionals, worked together to discuss my options with me and present kind of models for reconstruction. So afterwards, I feel very lucky to work with a group of people, including my plastic surgeon, who helped me feel whole again, helped me feel like a woman again, and presented me with the choice that was right for me.
Wow, that's great. Well, Dr. Song, why do so many women feel misinformed about their options regarding breast reconstructive surgery?
Well, I think that when they're diagnosed with breast cancer, there are so many things that are going through their mind, rightfully so. We want to make sure that women have that opportunity to make the right, well-informed decision for themselves. As a testament to that, the American Society of Plastic Surgeons spearheaded the passage of the Breast Cancer Patient Education Act, which mandates that all patients get informed about their choices so that they can make the right decision for them at the right time.
Great. Well, Karen, are there some obstacles women face when making the decision to undergo breast reconstruction surgery?
Sure, yeah. I think one of the obstacles is probably a lack of information. And again, I feel lucky that I was presented with a lot of options. I was able to go to websites, including breastreconusa.org, where I was able to look at patient stories. I looked at photos of different reconstruction options, and I chose the option that worked best for my lifestyle. I've got a very busy lifestyle as a performing artist and as a mom, and my doctors helped me make the choice that worked best for me and enabled me to get back to my life and feel whole again and feel confident again. Unfortunately, I think some women do have a lack of information, but I feel lucky that this team of doctors helped me make the choice that was right for me.
Well, it's great to know there's options, right?
Yeah, absolutely.
Yeah. Well, doctor, how important is it to include a plastic surgeon in your cancer care team? And what information should women be aware of during all of this reconstruction?
Well, again, there's so many options in breast reconstruction, and we want to make sure that breast cancer patients are provided that information from the beginning. So having a plastic surgeon as part of the team is an integral import, and we want to make sure that women understand that there's ways and different ways to reconstruct, whether it's using your own tissues or using an implant or a combination of the two. So to get that information, women can go to breastreconusa.org, where they can see the different types of reconstruction to get a sense of the look and feel and be informed.
Great. Now, is there anything we didn't cover on this interview?
I feel like I just want to tell women that there are options out there for you, and that this diagnosis doesn't have to, I feel like my breast reconstruction was able to turn something that might be looked at as a negative into a positive, and I feel alive, and I feel whole, and I feel confident. And I think it's important to let women know that there are options out there to help you get through this.
Great. Well, thank you so much for your time this morning again.
Thank you.
Thank you.